First off, let's touch on that election. How confident is the ruling party in garnering a bigger majority than the last election?
Good morning, Haslinda. Thank you for inviting me. Well, as Prime Minister's pointed out, we've got quite a lot on our plate going forward the next few months. The public health crisis is certainly far from over, although our numbers and the situation here in Singapore is certainly much improved. The economic impact is only starting to really be understood, and it's likely to last for some time. So we've got a lot on the plate going forward, and Prime Minister made the point that we need that mandate to lead through this crisis and have the support of our people. At the same time, we've learned quite a lot about the virus, and finding a way to do the elections safely has now become possible. We know what are the circumstances under which there is risk of spread and how to take steps to protect people. And so the operations, the execution of polling and campaigning will be altered in order to make sure that it's safe. So it's something that we have to do, and we're going ahead. The button has, as it were, been pressed.
The handling of the virus is expected to be a defining issue at these elections. Do you think the issue will work for or perhaps even against the ruling party?
Well, it's really hard to be absolutely precise. Partly the adage of a week being a long time in politics is also true for pandemics. It's very hard to be absolutely sure where we'll be in a week from now with our cases, if there's a cluster, if there's an infection, if there is poor compliance to some of the hygiene and interaction restriction orders that are in place. A lot can change between now and polling day, and that's certainly something that we're watching out for. The pandemic has indeed affected us completely as a total society, and has made the interrelationships between Singapore and the rest of the world, our economy, apparent to all, including our vulnerabilities that we have discussed for some time. As to how this translates into results on polling day, I think I wouldn't like to hazard a guess. This is not something that we want to play punditry with. I think we need to put our case out there to the people of Singapore about what we've done, the measures that we've taken. The results are there for the people of Singapore to see, and they will be the best judge of this. The reality really is that I think this election is going to be not so much about what has happened already, but what is the anticipation of the future and plans to come to deal with the future of this crisis, as well as our country.
And speaking of the future, Singapore is tapping technology to ensure that the pandemic is contained. It is the first country to roll out a national Bluetooth contact tracing app. Give us a sense of why this didn't work initially, and how confident are you it will?
Yeah, I'm going to take you to task on the fact that when you say it didn't work initially, it's working just great. From a technical level, I mean, the issue is firstly that we haven't got past the threshold of adoption for it to transform the way we do contact tracing. But that was never the point. We have a very robust and effective contact tracing process, and the Trace Together program, as well as some of the other technology tools that we have deployed, were meant as an augmentation to our public health response. So from that perspective, it's working and has been working. The question is for how many people and how effectively? Well, the various tools have significantly sped up the contact tracing process, have brought down the time it takes to identify and isolate and quarantine people who are contacts of index patients, and slow down the spread. So the technology works, but the key issue is that it's an augmentation to what is a human-driven, professional capability of public health contact tracing. We think that this is important to push
give us
forward.
A sense of.
We think it's important to push forward. I just want to make one more
point. Give us a sense of Singapore's broad strategy. Go ahead.
No, go ahead. No, you go ahead. I'll put this part of the answer into my answer to the next question. Go ahead.
I'm just wondering, give us a sense of the broad strategy when it comes to tapping technology in fighting this pandemic, because Singapore decided to ditch the app developed by Apple as well as Google together when, the UK has decided to ditch its own app for that. So what's Singapore's broad strategy?
We didn't ditch anything. Let's be very clear. Our app and our Blue Trace protocol came out some significant time before Apple and Google's EN notification protocol. So our app was in play and was being deployed, and currently it's being downloaded by 2.1 million Singaporeans, 35% of our population. And that process, the Trace Together program, started long before we had wind of Apple and Google's plans for an exposure notification program. So our strategy has been to speed up the process. And what we needed was a way, firstly, to make sure that our tools could be deployed for all Singaporeans. And that's why we have the Trace Together app, and that will be complemented by the Trace Together token. Because when we put the two together, as well as an integration with other technical tools, digital tools, we have the possibility of helping every Singaporean be part of this program. And that's an important part of our consideration. Secondly, we wanted to keep the process centered around the public health response. This is a healthcare problem. It's not a technical problem. This is not a technology issue. It's a healthcare problem. And so Apple and Google's exposure notification system does not allow the public health officials the insights that they need to derive in order to work out, well, that this cluster happened as a result of singing. We've had one of those, or a particular eatery, or a particular social activity. The way in which we tackle this crisis, this pandemic, this healthcare crisis going forward, it doesn't just require us to know who the patients are and have them either isolated or admitted to hospital. We have to rethink how we do certain activities, how we do urban design, how we design buildings, entranceways, and activities. This needs insight, and you can only have that insight by having the data. And Apple's and Google's exposure notification protocol doesn't allow our public health officials to have that data. We're not ruling it out. It's a great piece of technology, but it doesn't serve our purposes at the moment. And that's why we have chosen not to adopt it and to continue along the development path with our Trace Together program. The door is open. I mean, we have very high smartphone penetration here in Singapore. A significant number are Android and Apple users almost well. So if it meets our needs, we'd be open to considering it. But our outcomes, protecting the health of our people, establishing the information required to do so, and having full inclusion of our entire population need to be achieved in order for us to change our minds on this.
Minister, you talk about 30% adoption. That's still very low. And you talked about how the token will be deployed to all residents. When can we expect that to happen?
Yeah, 35%, 2.1 million of our population is low from the standard that we are trying to achieve, but it's one of the highest in the world. And none of the other deployments around the world have significantly surpassed this. Most countries are hovering much lower. There's a handful that are in the similar ballpark, but ours is one of the highest in the world. And that's in a way, a testament to the extent to which Singaporeans are willing to use technology to help fight this. The Trace Together token, well, we're starting to roll it out. We're still in the process of developing and testing and validating it. The tokens already exist, the first tranche as prototypes that we've engineered. And that rollout will be progressive from the end of the month to the end of the year, potentially, depending on how many people use it, need to use it, I beg your pardon, and how it gets deployed. Now, don't forget, we're not trying to use the Trace Together token to replace the app. It is to augment the app. And so if people are happier using the app on the smartphone, they don't necessarily need a token. There are pros and cons. The token is a simple device. It doesn't need recharging. You carry it around with you. You don't have to worry about effects on your battery life and on your phone, which some users with older phones particularly are worried about. So it's a complementary tool to the smartphone app. But well, we will get going with that and right. Slowly roll it out.
Minister, just one question before we go. There are issues to do with privacy and surveillance. What guidelines, what precautions are being taken?
Well, we've made it very clear that the app itself doesn't feed back live data to our Ministry of Health. It doesn't track a GPS location. It doesn't do many of the things that people have alleged. It only does proximity tracking through this Bluetooth protocol. We've made the app software open source, so any number of third parties and interested people have tried to hack it, tried to verify that this is indeed what it does. And they have done so, and they've published and verified that when we say this is what it does, that is all there is to it. We're taking the same approach with our Trace Together token. It's not exactly the same protocol, but we've organized a teardown. It's a hardware piece, and we've had engineers come in, and they've established that there's no GPS, there's no cellular. The data remains with the individual. Yes, Haslinda. The data is protected. I just wanted to make that point. The